Clear pee is not a flex. It is one of the most common hydration mistakes people brag about. You chug a giant bottle, check the toilet, see crystal clear, and think you are doing everything right. But that can mean you are washing out electrolytes, running to the bathroom all day, and still not hydrating the way you think.
Color is a useful signal, but it is easy to misread. Sometimes clear is fine. Sometimes clear is your body waving a yellow flag.
The goal is not the clearest possible. The goal is the right signal for the right moment. Moving to slide 2. Urine color mostly comes from a yellow pigment made when your body breaks down old red blood cells, and your kidneys send the leftovers out. Your kidneys also adjust how much water gets packed into that urine. More water going through means the pigment is diluted, so the color looks lighter. Less water means the pigment is concentrated, so the color looks darker. That is why a single sample is just a snapshot. You can be well hydrated overall and still pee darker first thing in the morning. You can also slam water right before the bathroom and get a nearly clear sample even if you were behind all day. Color is feedback, not a score. Read it like a moment-to-moment signal, not a permanent identity label. Moving to slide 3. Clear can happen for simple reasons. A big water bolus can dilute your next trip. Caffeine and alcohol can increase urine output for some people, especially in higher amounts. Diuretics and certain meds can do the same. Anxiety-driven sipping, where you keep drinking just in case, can keep you running clear. And pre-test overhydration before weigh-ins or labs is a classic. Clear urine is not automatically perfect. It can just mean you outpaced what your body needed right then. Moving to slide 4. Clear becomes a problem when it is constant. If you are clear all day, peeing close to hourly without a clear reason, or waking multiple times at night just to urinate, that is not a hydration win. If you feel thirsty even after drinking a lot, or you get lightheaded, headachy, or nauseated when you push water, take that seriously. Overdoing water can dilute sodium, and that can make you feel awful. A practical check. If your urine is consistently clear and your day is built around bathrooms, stop forcing fluids to be safe. Drink to thirst for a bit, include normal meals with salt, and watch how you feel. If the pattern persists or symptoms are strong, talk to a clinician. Your body should not feel like a leaking faucet. Moving to slide 5. For most people, the sweet spot is pale straw to light yellow. That usually means you are getting enough fluid without overdoing it. Slight yellow is still fine, especially if you have been busy, sweating, or just not drinking for a few hours. Use patterns, not perfection. Check a couple samples across the day, not just one. Morning urine is often darker because you have gone hours without drinking. That can be normal if it lightens after breakfast and a drink. If you train or work in heat, expect darker urine later unless you actively replace fluids and sodium. If you sit in air conditioning all day, you may not need as much. Match color to your day. If you are pale straw and energy is steady, keep your routine. If you are crystal clear and you are peeing nonstop, back off the constant sipping and let thirst guide you. Hydration is not a contest. It is calibration, and the right color usually looks quietly, boringly normal. Moving to slide 6. Dark yellow to amber urine is most often just concentrated urine from not taking in enough fluid. If you have been sweating in heat, exercising, working a physical job, or drinking alcohol, you can lose water and sodium faster than you realize. Fever, diarrhea, and vomiting push you into dehydration even quicker. Use your other clues. Dry mouth, thirst, a headache, lightheadedness when you stand, and peeing less often all support dehydration. What to do is simple and practical. Start with water, but if you have been sweating a lot or have GI illness, add electrolytes, not just plain water. A store-bought oral rehydration solution works, or a sports drink diluted with water if that is what you have. Sip steadily for the next couple of hours and watch for your urine to gradually lighten. If your urine stays very dark despite rehydrating, or you cannot keep fluids down, that is a different situation. Color can be a helpful signal, but not every shade points to the same problem. Moving to slide 7. Orange urine can still be dehydration, but it deserves a closer look. First, check the obvious. Some medications and supplements can turn urine orange, like phenazopyridine for UTI pain and sometimes certain vitamins. If the timing matches a new pill, that may explain it. The more important possibility is bile pigment showing up in urine, which can happen with liver or bile duct problems. Look for pale or clay-colored stools, new itchiness, dark urine that does not improve with hydration, or yellowing of your eyes or skin. If those jaundice signs are present, call a clinician the same day. Orange can be harmless, or it can be a warning flag. When the color shift comes with other body changes, treat it as information, not trivia. And yes, some colors can feel a lot more alarming than orange. Moving to slide 8. Pink or red urine can be totally benign, or it can be blood. Start by ruling out common false alarms. Beets, blackberries, rhubarb, and foods with strong red dyes can tint urine for a day. If you ate something like that, do one more check after your next few bathroom trips. Next, consider contamination. If you are on your period, blood can mix with urine in the bowl. If possible, use a tampon or menstrual cup and try again. Or collect a clean catch sample. Wipe, start peeing, then catch midstream. If the color persists without a food explanation, treat it as possible blood in the urine. Pay attention to clues. Burning, urgency, and frequent small pees suggest a bladder infection. Flank pain, nausea, or waves of severe pain can point toward a stone. Either way, repeated red or pink urine needs medical evaluation, even if it goes away, because you want the cause documented and treated. When red turns into a deeper cola or tea shade, the list of causes shifts again. Moving to slide 9. Brown or tea-colored urine can still be severe dehydration, especially after a long hot day with heavy sweating. Rehydrate and see if it lightens over a few hours. But this color also raises two bigger concerns. One is muscle breakdown after extreme workouts, heat illness, or prolonged immobilization. If you have intense muscle pain, swelling, weakness, or you pushed far past your normal training, dark tea urine is a reason to get urgent care the same day. The other concern is liver or bile issues, especially if you also notice pale stools, itching, or yellowing of the eyes or skin. If the color persists or comes with those symptoms, do not wait it out. With darker shades, the safest mindset is this: hydration can fix concentration, but it will not fix pigment from injury or bile. Your body is telling you what kind of fluid is in the mix. Sometimes it is not just water that changes the look. Moving to slide 10. Foam and bubbles are tricky because they are often just physics. A fast stream, a small amount of urine, or a freshly cleaned toilet can create bubbles that look dramatic and then fade. What matters is persistent foam that sticks around, especially if it happens repeatedly and looks thick or frothy. That can be a sign of protein in the urine, which deserves a proper urine test. Do a quick self-check for other clues that go with kidney strain, new ankle or eyelid swelling, higher than usual blood pressure, or unexplained fatigue. If you have diabetes, high blood pressure, or a known kidney issue, take persistent foam more seriously and book an appointment soon. Urine appearance can give you useful signals, but it is only one piece of the story. The next step is knowing what color can never tell you on its own. Moving to slide 11. Urine color can give you a clue, but it cannot tell the whole story. It does not confirm you are truly hydrated. It does not guarantee your kidneys are functioning well. It cannot show sodium or other electrolytes. It is not a reliable screen for blood sugar, and infections can show up with little or no color change. If you want confidence, you need a smarter check than a quick glance. Moving to slide 12. Use thirst as a real tool, not something to ignore. If you feel thirsty, start with a measured drink, then reassess instead of chugging. Track how often you pee and roughly how much. A normal day for you has a pattern. Pay attention to dizziness when you stand up, headaches, dry mouth, and unusually dark, strong-smelling urine together, not in isolation. If you train, weigh yourself before and after. Each pound lost is about 16 ounces of fluid. So replace that over the next few hours with water plus salt and food, not just plain water. The goal is steady function, and your body will tell you when something is off enough to take seriously. Moving to slide 13. Some signs are not a hydration problem. They are a get help problem. If you see blood in your urine or clots, treat that as urgent, even if it goes away. Fever with urinary symptoms can mean a kidney infection. especially if you also have back or flank pain under the ribs, shaking chills, or you cannot keep fluids down because of vomiting. Those can deteriorate quickly. A sudden new combo of extreme thirst and peeing a lot, especially with fatigue, blurry vision, or unexplained weight loss, needs medical evaluation the same day, because high blood sugar is on the list. Yellowing of the eyes or skin, very dark urine with pale stools, or intense itching points away from simple dehydration and toward liver or bile duct issues. And if you are confused, severely drowsy, or not acting like yourself after heavy drinking, do not try to sleep it off. Alcohol can mask dangerous problems, including very low blood sugar, head injury, or alcohol poisoning. In these moments, urine color is a distraction. Your safety matters more than being tough about it. Moving to slide 14. Stop chasing perfectly clear. Aim for steady, not extreme. Let color be a hint. Then check your pattern across days, your thirst, and how you feel. If the signals disagree, symptoms are the tiebreaker, not the shade in the bowl. If this changed how you think about hydration, subscribe for more practical health breakdowns. Comment your biggest surprise from these slides. This content is for educational purposes only and is not medical advice. Your metabolism follows signals. Learn to control them.